Intermittent explosive disorder is out there. A lot of people are experiencing it. Shouting on top of your voice can actually cause headache, and the palpitation, the heart racing or tremor, it's like you are telling your entire body to be at work at that particular time. Today we are talking about intermittent explosive disorder. My name is Obapeni Awojemfua. This is a condition where the person has an uncontrollable outburst or rage of anger over minor issues or issues that does not even warrant that kind of anger. And this anger, it comes as quickly as unexpected, and it can actually last 20 years or even a lifetime. It is caused by genetics, which is family inheritance, and then we also have environmental factors. So wherever you raise your child or wherever that you were raised actually can trigger this condition. You were raised in an environment where your parents shout at each other, or where there's fight going on every other day. It can result in intermittent explosive disorder. Their childhood traumas. Children who were raised in a conflict condition or traumatic, they have had traumatic experience that they couldn't defend themselves at that time, or they saw what they shouldn't have seen at that particular time or at that particular age of their life, can actually result in intermittent explosive disorder. It can actually stem from brain malfunction. Some of the signs that you would see these people exhibiting is, first off, they are quick-tempered. When they are about to experience these episodes, they have this heart racing or tremor, palpitation, and muscle tension, which brings out the outburst or the explosion, followed by an intense, uncontrollable arguments, unnecessary arguments. They are angry for something trivial or whatever that has happened. The way the outburst came out or the explosion came out, they weren't supposed to have behaved that way. It can be frequent physical or verbal aggression. So the aggressiveness can be physical. They can get physical with you or verbally abuse you. You see them experiencing these headaches because when you shout on top of your voice, it's like you are telling your entire body to be at work at that particular time. They don't have high tolerance level. In fact, their tolerance level is very low. They will not tolerate anything that you think is normal. If it's not normal to them, it's not. They won't tolerate it. And this actually results in short period emotional detachment. 1 minute they are okay with you, they are good. The next minute you said something, and if it's something that will trigger the explosion, yes, you get it from them. One amazing thing about the condition is that after they are done with the episode, after they are done exploding, yelling, being aggressive, they regret. They have this sense of regret after everything that they will do. With some of the effects, they are mostly having unstable relationships. They are unable to sustain relationships at all. They can't, due to they getting physical. Sometimes it can lead to self-destruction and harming the other person, and also destroying properties. Most often, they find themselves in legal issues. They find themselves in legal issues because you get physical with somebody, the next thing, police will come for you. So most often they are dealing with legal issues, and they are always having financial problems due to this legal issues that comes with the aggression and the explosion. They are unable to sometimes sustain jobs. They are unable to sometimes finish their school. Those who are able to finish their school, as I said, they can't sustain one particular job. It's either you compromise with him or her, or you let her go, or you let him go, or that he can't fit into the environment, so he would leave. They have low self-esteem, and this mostly will result in them getting into substance abuse, alcoholism, and drugs. Aside the headache that they mostly experience, some of the effects that they get is heart issues. They are always having high blood pressure, and then it can even result to stroke. They get in stroke. Now, severity of this condition varies from persons to persons. If the person is able to get early diagnosed and then treatment, he or she will be able to manage the symptoms and also be able to prevent the negative consequences of this explosion or the condition. For therapy, we're looking at cognitive behavioral therapy. It's one good therapy that helps them manage the anger and then the aggression and how to control themselves, so not to get to that explosive point. We also have anger management technique that will help the person have control over the anger, the explosion, the palpitation, or the tension that they feel when the condition is being triggered or when they are being triggered. And there are some medications that the physician will also recommend for you to use. It's quite difficult living with these kind of people. But let's say you have a relative, you have a loved one who you think may be having this condition. The moment he or she gets the explosion and then comes back to default and regrets in all his actions or her actions, that for me should be the time or the opportunity for you to talk the person into getting a therapy for himself or seeing a physician for help. Thank you. I'll see you in my next episode. Take care. Bye.